One of the other things that us cardiologists and interventional cardiologists treat is peripheral arterial disease, or PAD or PVD. The same process that affects the arteries of the heart is called atherosclerosis. It starts as deposits of fats and cholesterol in the vessel wall, and eventually that leads to blockages and formation of calcium blockages. Those can be mild, severe, or complete, and those can lead to different types of symptoms like claudication, which is pain in the legs with ambulation or with exercise, or in severe cases where the arteries become completely occluded, patients can present with ulcers, lesions, and non-healing wounds of the feet. So what we do is similar to what we do in the heart. We do an angiogram of the arteries of the legs, and then we revascularize, or we open the blockages with balloons and sometimes stents. Now, cardiologists are traditionally trained to treat the heart because that's what we are, cardiologists. But we are also vascular specialists, and especially interventional cardiologists. We're trained to do procedures in small arteries of the heart, and the arteries of the leg are pretty similar, and in the same way that we treat the heart, we use balloons and stents. The stents have become better. There are more brands available. They're coated with medication that keeps them from restenosing or forming blockages down the line. The tools we use to treat the blockages, like wires, balloons, stents, and different tools, have also become better. So now we can treat more complex and more severe blockages that were traditionally sent to bypass surgery 10, 15, 20 years ago. Now we can open a lot of those blockages without the need for surgery, which is helpful in patients that are either too sick to undergo bypass or are at too high of a risk to undergo bypass. They have the option of having it done percutaneously with stents.